All right, here we go. All right, so we have Mariana Whitley Tumlinson, which is the Director in Community and Public Relations, and also the Chief Nursing Officer, Frank Acevedo, on the line right now from Valley Regional Medical Center located in Brownsville, Texas. So right now, obviously, we're getting a lot of information that just isn't true, and I kind of wanted to kind of spearhead this because people don't know where to get their information from. And they just don't know what a reliable source is or who to listen to. So I wanted to first off get you all to introduce yourselves, please.
Well, hey, good morning. This is Mariana Tumlinson. As you mentioned, I'm the Director of Community and Public Relations at Valley Regional Medical Center. Thanks for having us today.
So good morning. This is Frank Acevedo. I'm the Chief Nursing Officer here at Valley Regional Medical Center. I've been here 24 years.
Great. Well, it's great to have you all on the podcast. I thank you for your time, especially during this time of uncertainty, right? So what I wanted to get down to is what are the hospitals doing right now in preparation for the coronavirus?
Sure. So that's a good question. And I think to help ease everybody's concerns, for the last couple of weeks, we've actually set up an incident command here at the hospital. So what does that mean is that every day we're on the county calls. We're talking amongst the leadership team, making sure that we have the necessary supplies and staffing to be able to take care of our community. So we're disseminating information to the staff, right? So they're up to speed. CDC guidelines can change daily, if not weekly. So we want to make sure that our staff are well prepared for that. Some other things that we're doing as a hospital is that we are limiting the amount of visitors that are allowed in the hospital to help keep our community safe and the patients that are in the hospital. And we also want to make sure that we monitor our supplies and our PPE equipment to make sure that there's enough for our healthcare providers to provide safe care to our patients.
Great. So what should we be doing to protect ourselves right now from the coronavirus?
So that's a really good question. I think that's the $1 million question. And some of the basic stuff is, washing your hands, avoid touching your eyes, nose, and mouth, avoiding close contact. Like having a podcast is much better than doing an in-person interview, right? Just throwing that out there.
I agree.
Stay home if you're sick. Cover your mouth and nose when you cough. And throw away any used tissues or any napkins that you use. And most importantly, do not forget to wash your hands or sanitize.
Yeah, definitely. I created a video on how to make your own hand sanitizer with just with some high proof alcohol and some aloe vera, and it works really good. So I think being able not to get that stuff at HEB or the dollar stores there's alternatives that we could use as a community.
Sure, and a bar of soap goes a long way. And there's plenty of soap out there, so that is just as effective in washing your hands too.
I completely agree. In your professional opinion, both of y'all, do you think there are already cases here of the coronavirus? I know there was something leaked here in Edinburgh, but it found to be untrue. So what are your thoughts on this?
So I think there's a lot of misinformation, and that's probably the worst thing that we can do is assume. As of right now, there is no cases in Cameron County or Hidalgo County. So in my professional opinion, I would say not to speculate, go with the facts. The CDC and the counties will print that out there. And right now, that's what we have to adhere to.
Okay. Also, President Trump just announced on Wednesday he invoked the Defense Production Act, which is the DPA, which forces companies to make needed medical supplies in order to provide necessary medical equipment to treat actual patients. Have you already seen this?
No, we have not. But we're keeping track, what's called the burn rate of how fast we're going through supplies to ensure that we have enough to take care. So we are really stocking up to making sure that we can endure this for however long it takes.
So as of right now, are the hospitals equipped to be able to take on this pandemic if it were to spread?
Absolutely. We have practiced in the past in a lot of these type of scenarios. We're in a constant mode of readiness. So there's a lot of provisions that we're taking to help prepare, and it's really communicating with each other. So it's not just our hospital, but we're communicating with our local hospitals in the county and even in other counties to ensure that we're all communicating with each other to share resources, right?
Yeah.
And I mean, it's about the community first.
That's great news to hear, because people just don't know, and they don't know where to get their information from. So,
And if they don't know, they'll make up their own truths.
Yeah, exactly.
So I'm glad that we're able to clarify.
So should the RGV be in panic mode right now?
No, absolutely not. That's probably the worst thing that we could do. We should never panic. It clouds your judgment and causes unnecessary stress. We need to trust our local CDC and our county officials to give us proper direction. So all the panic does is create unnecessary stress.
I completely agree. Have you heard anything about a national shutdown?
I have not heard of a national shutdown, but I know that City of Brownsville is limiting large congregation events, some of the parks, but it's just limited. Nothing's shutting down.
Nothing shutting. Yeah, I believe I had a podcast with Chef Larry Delgado yesterday about the restaurants and bars, and they're taking a hit right now. So they're trying to figure out ways to be able to, I guess, comply with the city ordinance as well, but also to be able to survive this whole thing. It's going to be an interesting time. Okay, so do you have any other insight that you can share with our listeners?
I do. I think this is a historic moment for all of us. How we deal with this pandemic will define us as a community and as a nation. We need to be considerate and adhere to all recommended CDC guidelines to keep us safe, and to remember not to panic. Your local hospitals are in a constant mode of readiness for different scenarios and have different contingency plans. And I think the more that we message this to the public, they'll feel comfortable that we're prepared to take on this pandemic.
And what about you, Mariana?
I just think that, again, thank you for having us and being able to clarify things, and just don't panic. Take care of yourselves and take care of those that can't take care of themselves, like the elderly. Make sure that we're practicing social distancing so we can flatten the curve, and just to make sure that we can squash this, if you will, by preventing it to continue, by preventing the spread of it. So this is to take care of ourselves and each other at this point.
When you talk about flatten the curve, explain to everybody what that means. I don't think people really understand what that means.
Well, you want to take
this? So flattening the curve. I mean, the communication has to go out. We need to make sure that we're not overutilizing our resources, and making sure that that the testing is not just running out of control. That people actually are being tested when they meet the criteria to be tested. That really is what flattening the curve means.
And, to slow the acceleration of the number of cases that are out there.
Right.
We want to reduce the cases that are related to this diagnosis, and also to reduce the amount of the demands on the hospitals. And so if we reduce the acceleration or slow down the acceleration of the cases that are out there, we reduce the number overall and reduce the spread of it. Does that make sense?
Yeah, definitely. And a few ways that people can practice this is by social distancing and not going out if they feel sick. Yeah, because that will overwhelm the hospitals. I mean, you're putting yourself at risk, right, once you go out.
Correct.
So, yeah, I appreciate your all's time. Once again, if you have any other insight that you can share with us, any other information that we can share.
We just recommend for this kind of information to visit the CDC website, and they're updating constantly, and they have great communication for communities, for churches, for even how to talk to your children about COVID-19, the coronavirus. So that's a great resource for the most accurate communication that I think you can find.
Okay, great.
And be cautious of misinformation.
Definitely. Yeah. All right. I'd like to thank you all again. We got Mariana Whitley Tumlinson, which is the Director, Community and Public Relations, and Chief Nursing Officer Frank Acevedo from Valley Regional Medical Center located in Brownsville, Texas. Once again, guys, thank you all very much.
Thank you. Thank you so much. Have a great day.
You too.
And stay safe.